First thing I do is a patient assessment. You want to check for loss of consciousness. You want to check loss of memory. You want to check for drowsiness, irritability. Some of the questions I would ask is, do you remember the incident? I would ask them if they knew who they were, some of the basic questions, if they didn't know who they were, time of day, they know where they're at, and who's the president. Oxygen, high flow, put them on a backboard, stabilize their neck. It's very crucial in pre-hospital care to prevent further injury. With possible neck injury, we want to secure that foremost. So put them in C-spine, put them on a backboard, provide the oxygen to the brain if there's lack of it, and transport immediately.
We will start off with the head-to-toe assessment that first includes airway, making sure the patient is able to breathe on their own. They're not needing to be resuscitated and put on life support. So as long as we're checking to make sure that they're breathing well and they have good circulation, we move on to a neurological exam. That we would look for on a concussion would be any change in neurological status. So we would start off with asking them what their name is, if they know where they're at, if they know the year, and then we would also check to see if they were able to lift up their extremities. We start off with one extremity at a time. We would have them lift up a right arm, right leg, left leg, to make sure that they're neurologically intact. We would also assess their pupils to make sure that they're equal and reactive to the light. We would shine light into their eyes and make sure that they constrict when the light hits their pupils. Concussion syndrome could start anywhere from immediately after the concussion to a month or two later, and this would consist of either one or a few symptoms such as fatigue, irritability, nausea, vomiting, depression, are all symptoms that would come with a post-concussion syndrome. palpating their cervical spine, making sure that there is no neurological damage. So we would log roll the patient onto their side and palpate from the top of their neck all the way down to their lower coxal area. After we do our head to toe assessment, we will draw a full panel, laboratory panel, and also we would do a head to toe scan, and we'd also do x-rays. Once the patient is stable, we would transport the patient on a cardiac monitor to our CAT scan department. Typically, if we were going to determine if a patient had a concussion, it would involve ruling out any serious injury to the brain. So once a patient returns from their CAT scan and we determine that there's no bleeding in their brain, and their CAT scan is negative and their x-ray is negative, if we have a positive loss of consciousness during the head injury, we would take the symptoms that the patient presented with the negative CAT scan. We would typically say that a concussion is temporary loss of consciousness with a negative CAT scan. So we would basically say a negative CAT scan with the patient returning back to their baseline neurological status.